Redo. Okay, perfect. Welcome. Integumentary system. Okay, so we will be talking about the cells of the epidermis, the layers of the epidermis, epidermis of hairy skin, so our animal friends that have fur versus those hairless ones, the dermis, which is a different layer, and the layers of that layer, and the hypodermis, which is also called the subcutaneous layer. Afterwards, we're going to go over some special features of the system, which would be pigment of the system, specifically paw pads, the nasal planum, some different pieces of horses that are not very common but part of the skin, and cutaneous pouches in sheep, which is kind of a unique function and thing that they have. So I need to move your sweet faces out of my way. Remember, I can't see all of you guys, so if there is, oh, there's Diana. So if you do have a question, make sure to stop me. And perfect. Okay, so integumentary system, so the skin, and there's a lot of structures of the skin that are related and have different functions. The functions of the system are to cover and protect, prevent desiccation and reduce threat of injury, so kind of wounds there is kind of what we're referring to. So assisting in thermoregulation, so heat management, excreting water, salts, organic wastes come through your skin, receiving and conveying sensory information. We're going to talk a lot about nerve stuff, which we've kind of talked about with the different organs already. And it synthesizes vitamin D and stores nutrients for later use. So those three layers, just to kind of say them again, epidermis, dermis, hypodermis. More specifically, so now we're going to start with the epidermis, so that top layer, epi meaning above. So they have keratinocytes, which is the majority of the cells. They produce keratin. Keratin is the substance that gives skin resiliency and strength. It's a waterproof protein. So we're essentially kind of waterproof, right? Otherwise, when we'd go swimming, we wouldn't just be wrinkly, right? We would be absorbing all the things going on. The cells use the blood supply of the dermis that's underneath them to stay nourished and grow and divide. So it's essentially avascular. There's different capillaries and such, but it uses the blood supply of the dermis specifically. That's pretty important. There are melanocytes there also. Those produce melanin, which is your pigment. And your Langerhans cells, which are essentially like little Pac-Men, they phagocytize microinvaders, so like they eat them, they find them and they eat them. It's a macrophage. So that is what that cell is specifically. I don't know if this is Merkel or Merkel. I've always said Merkel because I have a friend with that last name, and I try to associate some of these terms that I don't use all the times with things that I'm going to remember. That way it stays right at the top of my brain. So Merkel cells are associated with sensory nerve endings. So they are found in small numbers at the epidermal-dermal junction. The macrophage, I want to go back to that because I have a note here I didn't want to forget to tell you. That's why I take notes. The cells themselves originates in the bone marrow and they migrate to the skin. I thought that was totally fascinating that they aren't created in the skin themselves. They're part of the bone marrow. Layers of the epidermis. So 5 are listed here. So 5 is what humans have and your hairless animals. The animals that have fur tend to have 3, which we're going to talk about all of those. The 3 that fur animals tend to have are the 1, the 4, and the 5. So make sure you write that down as we get to the structures that have more than 5 or more than 3. We'll go over those specifically. So number 1, the stratum corneum, which is also called the horny layer. So it is made up of dead cell remnants, essentially. So horny or cornified is kind of what it's talking there. So corneum, cornified, horny layer. So those are cornified cells, and this is going to also be referred to as dandruff. Number 2, stratum lucidum, is called the clear layer. It's a translucent layer of flattened dead cells. So they've been essentially pushed up from the bottom and they're flattened. They're dead already, but they aren't that cornified yet. They aren't cornified. They're just flattened, pressed together. stratum granulosum, or the granular layer. That's actually the stage where the cell dies. So the cells layers above them, those are the dead cells. Granular layer is where the cell actually dies. And it sounds super morbid. Number 4, stratum spinosum, so spinosum or spiny layer. There is less cell division here and held together by desmodomes. And then 5 is, so think of germinate, that will kind of help you remember that, or the basal layer. That is where they are actively dividing. So it goes from top to bottom in order of the way that it's protecting you, but it actually is kind of easier to remember when you go bottom to top. So bottom, germinate or actively divide, the spiny layer, less cell division there, and then that granular layer is where the cell dies. So now that cell goes up to the clear layer, which is flattened, pressed together, then it becomes cornified and dandruff, and that makes it okay for cells when you get an abrasion, when you bump into something, when you scratch yourself, things are flaking off, but you're not actually causing damage to yourself or your skin layer because it's already dead cells there. Does that make sense? Any questions on that? Let me see.
Which 3 layers did you say animals generally have?
1, the animals with fur, good, thank you for having me bring that back up. So animals with fur tend to have 1, 4, and 5. So they all need to have that germinating layer down there. And then the 4, so that spiny layer, and then the top layer. We all have that cornified cells or that horny layer, stratum corneum. Good question. Let me see, I had some side notes. Side number 1, layer 1 constitutes 3/4 of the thickness. These are like my fun facts that are really important, that when I read the textbook also, I'm like, oh, that's amazing. So number 1 constitutes 3/4 of the thickness of the epidermal layer. So that makes sense, right? So we want, how to move your little faces again. I just can't figure that out either in my life. So we want to be able to be protected. So if we're bumping into things, like I said, scratching, skin is flying off, walking, since we know that the paw pads, etc., are all part of skin layers. So it is super important to have that top layer be extra thick. Good question. Let's see here. Dermis. So the dermis is the layer underneath, or the middle layer. And that's kind of easy to remember. Dermis is kind of your main vascular layer. And then you have epi, meaning above, or subdermis, meaning below. So that's kind of an easy way to remember that. So the dermis is the greatest portion of the integument. So you're like, what? You just said that there was a different layer that was the most. That's why it's important to keep track of those columns of the different layers, and then each layer has different layers. So the top layer of the epidermis is the thickness of the epidermis. But the dermis, so that middle portion, is the greatest portion of the integument overall. Does that make sense? We kind of follow in that part? Okay, so when you're asked which is the greatest portion of the integument, what is it? Come on, stone faces.
The dermis.
The dermis. But if I ask you what the thickest portion of the epidermis is, what are you gonna say? Come on, stone faces.
Horny layer.
The horny layer, the cornified layer, the stratum corneum, any of those things, that's the thickest portion of the epidermis. Now we're underneath the epidermis and we're on to the dermis. So the dermis is highly fibrous, dense, irregular connective tissue. It's not that flaky, dead skin. It's made of collagen, elastic, and reticular fibers. So that kind of gives it a stretchier part, so it doesn't just snap if you bump into something. There are lots of other components that are part of the dermis and not the epidermis. So specific hair follicles, nerve endings, glands, smooth muscle, blood vessels, lymphatic channels, fibroblasts, fat cells, and more of those Pac-Man macrophages. So the dermis has specifically 2 layers. Make sure you're writing this down. One layer is the papillary layer, and the other layer is the reticular layer. Got it? Following? 2 layers of the dermis. How many layers of the epidermis? Hold your fingers up. You can say 5, you can say 3. I kind of talked about 2 different things. Okay, so the layers of the dermis more specifically. Okay, papillary layer. So that's the upper portion of it. It's split into two. The top one is the papillary layer. Has projections on it, or in it, I guess, called dermal papillae. Some of those contain capillary loops. So think of capillaries, those are your little tiny blood vessels. So when you scratch yourself, you get a little bit of bleeding for capillary bleeding. Other house pain receptors and touch receptors. There are specific pain receptors there. Is it on this slide? Sometimes my printout is different than yours. No, so that means it's coming up. Hold that thought. The reticular layer is the deepest skin layer. So there's only two, a top and a bottom. That's pretty easy to remember. That has blood vessels. So remember, this is a very vascular layer because it's feeding the cells of the epidermis with nutrients and blood. It has sweat and oil glands and deep pressure receptors. There we go. I was getting ahead of myself. So with the dermal layers specifically, the papillary layer. So let's talk more about that. So it's a thin superficial layer. It has loose connective tissue, and it lies just below the epidermis. So there's these things called the Meissner's corpuscles. I think the word corpuscle is funny. That always helps me remember words, as if I think they're funny. And those are bundles of sensory nerve endings. So what do you think that is telling us if those are activated? What do you think? I'm going to call on Morgan.
Is it like your sense of touch or pain?
Yes, see, you guys know this. I don't know why you're staring at me blankly. Yes, so your touch and pain, superficial touch and pain receptors specifically are there. So Meissner's corpuscles. Say it out loud. I'm going to watch your lips. Kate's laughing. Alex, I can't see your lips. There they go. Meissner's corpuscles. That's a funny word. Okay, so that's easy to remember. Funny word. We got that. So reticular layer. So underneath that layer, and that's 80% of the dermis. See why I want you guys taking notes in kind of columns and maps? Because we're talking about the same thing with different layers. So the bigger layer of the dermis is the reticular layer, 80% of it. That's pretty huge. We know that the top layer is pretty thin. So there is an indistinct boundary between those two layers. Okay, that's kind of unique to some of the other tissue layers. Parallel bundles of collagen fibers, and those cause tension lines or dermal folds or flexure lines. So you can kind of see, actually this is a good picture showing the epidermis, the dermis, and the hypodermis. Okay, but you can kind of see that there's no distinct line in between those. And the deep pressure receptors are located there also. So superficial, deep, that makes sense, top and bottom layer. There's also oil and sweat glands in this layer. Blood vessels, actual vessels, not capillary vessels, are located here. So remember, the dermis is a very vascular layer. Questions on dermis? Give me a thumbs up. Okay. Want to make sure we're following. So hypodermis, hypo, underneath the dermis. That's like the easiest medical terminology ever. If you guys get that wrong on the quiz, I'm gonna cry. So this is also known as the subcutaneous tissue or superficial fascia. Write that down. It has more adipose than dermis. Okay, that makes sense. What's adipose?
Fat.
Like fatty tissue, yeah.
Yeah, so that is fat. So make sure that you know that. It also contains a touch receptor called the Pacinian corpuscle, my favorite word today. So what do you think that tells you? What do you think? Robert, what do you think?
Don't know.
So we talked about the Meissner's corpuscle. So that was sensitive to light touch because the corpuscles are sensory nerve endings. So if we're a deeper level, what do you think, Morgan?
So what was the question? Are you talking about like deep pain as opposed to like superficial pain?
Yes, exactly.
Cool.
So this is a little bit more deep pain, deep touch receptors, or heavier pressure is another kind of way to look at that. That's the Pacinian like, I don't know, I keep saying Pac-Man. I feel like that's a sign or something. So Pacinian, Pacinian corpuscle. Okay, let's see. So animals that have, let's see here, hypodermis, more adipose, we talked about that. Okay, we're on functions. So this stores energy and thermal insulation. That makes sense, right? Because if they are lacking a lot of tissue in this layer, it's not going to keep the heat in or keep heat out, I guess. So this has a very important job of thermal insulation. Hypodermic injections, if you've ever heard of having a hypodermic needle or a hypodermic injection. So this is the layer that it's talking about. It's into the subcutaneous tissue, highly vascular also. Why would that be important for injections? Why do you think?
You can avoid like muscle and the epidermis and things like that, because the only is like the TB test like an epidermal injection?
I believe it is. Actually.
Okay.
Or it's either dermal. Actually, I don't know if it's dermal.
Because I've heard about it before and I've read on it, but I don't remember if it was dermis or
I think it's
dermis
dermal,
or
actually.
okay. Yeah, but I forgot what we were talking about.
So why would hypodermic injections be, because it's highly vascular, like what's the association with injections and medications with that?
It can avoid like the muscle and everything.
Yeah, I see where you're going.
And whenever you aspirate, it's not supposed to be any blood, so I would think it would be to avoid a lot of blood vessels as well, even though it is vascularized.
It is highly vascular. Well, think more along of the pharmacokinetics. You've taken pharmacology. Let's see. Kate, let me switch to Kate. So you're right in structures. So if it's supposed to be in that area, that route, that makes sense. What about Kate or Ingrid? What do you guys think about, like, what kind of stage of pharmacokinetics, I guess, is what I'm trying to say, because it's highly vascular? If there's 4 stages, I know you guys know this. Absorption, distribution.
The transmission.
Yeah, right. So what stage, if you're injecting it and it's highly vascular?
Absorption?
Absorption, exactly. So remember, when you're placing something into a site, vascular versus avascular is going to be able to transport that drug molecule to the places that it wants to be faster or easier, or less, I guess, if you want something injected. Good job. Let's see. We talked about pain receptors, heavy pressure. Okay, so that's kind of the layers. You guys have any questions specifically? You could answer questions about which one's the thickest, which layer of each of those is the thickest, functions. Got it? Thumbs up? Okay, see some good smiles and some thumbs up. Awesome. So special features that we're going to talk about. So pigment, paw pads, the nasal planum. Stephanie, you are actually on this Zoom. I don't know how to pronounce this word. Is it ergo or ergot?
It's an ergot.
Okay, I wasn't sure if it was like French sounding kind of.
No, it's not that fancy. Just a plain old ergot.
Ergot and chestnut. Okay, I'll remember that. And the cutaneous pouches in sheep. Okay. So pigmentation, this is a result of the presence or absence of melanosomes. So melanosomes are cells of melanocytes that contain melanin granules. So those are in extensions, think of like little fingertips of the cells themselves, or the melanocytes, okay? So they are controlled by the endocrine system. You guys watched Dr. Jordan's endocrine lecture already, right? Okay, yep, so you kind of have the basics of how that hypophysis works. The hormone, melanocyte stimulating hormone, or MSH, controls that. And they are absorbed by keratinocytes. And then once they're absorbed into the keratin portion of those cells, they're dispersed onto the side of the cell that gets the most sunlight. So what is this pigment protecting the animal from? Ingrid, what do you think?
Sorry, I was taking notes. What was
So if the melanin is put into the keratin, and it's dispersed by the body to the side of the cell that gets the most sunlight. What is it trying to protect the body from? What do you think? Does anyone want to help her out? Kate?
Ultraviolet light.
Ultraviolet light or harmful UV rays. Y'all better be wearing some sunscreen because this happens to humans too. So keep yourself out of those UV rays then. So yes, so the body already has a natural way of trying to protect itself from UV rays by placing those melanin particles on the side of the cell that is exposed to the most sunlight. That's pretty awesome, right? It has to be in the cellular arms, which I have in my notes. I thought that was pretty fascinating, and surrounding tissue. So just because it's in the nucleus of the cell doesn't mean it's actually going to contribute to pigmentation, which I think is really interesting. The pigment is not present, is what I wrote down, if the melanin resides in the nucleus. So just kind of, does that make sense what I'm trying to say? So like there may be a certain quantity of melanocytes or melanin cells that are in the cell, but unless they're in like the dendrites or like the fingers of the cell and in the surrounding tissues, the pigment isn't going to show up. Make sense? Here we go. I got one nod. You guys are either really busy taking notes or you're sleeping with your eyes open today. It's Monday and I haven't seen any coffee cups. All right, let's see. So we're going to move on from pigmentation and we're going to talk a little bit about paw pads. Paw pads are pretty unique, right? We don't have paw pads. We don't have this, but we all like to sniff them and our animal friends, right? What do they smell like? Nothing?
My dad always say they smell like Fritos.
Am I the
Corn
only
chips.
weirdo? Am I the only weirdo that sniffs paw pads? Okay. If you have never sniffed a paw pad, that is going to be some additional homework for you guys today. What is the smell of my animal's paw pads? I think that's new task. Make sure that happens today. Okay, so paw pads, they are thick and they are tough and they are layers of fat and connective tissue, right? So they're not, I guess I don't want to say they're not epidermis because they have epidermal layers, but they're not like the thin dandruffy, they're not as stretchy as the rest of our skin because they're taking a lot of pressure and kind of a beating as the animal is walking on surfaces, whether it be hard or hot or any of those things. They consist of that conical papillae, so that's kind of a term pretty specific to the paw pads. And they have exocrine sweat glands, sweaty paws, which happens. So this is one that's, even if it's a furred animal, that specifically has all 5 epidermal layers. Okay, that's important to know. Those epidermal layers, remember, so the furless animals only had the 3, or furless. With fur animals tend to only have the 3. But so why do you think hairless animals would have more layers? Why do you think? Paw pads have 5 layers, hairless animals have 5 layers. So what kind of is that contributing factor of what might be happening? Megan, what do you think?
I was trying to think, but I don't know. I don't know.
Robert, were you going to answer?
I'll take a stab at it.
Okay.
I think, well, we have the upper layers that protect the lower layers of skin, which if you don't have any hair, you're going to need that. If you have the hair, you can probably get away without the upper layers because that hair is protecting.
Yeah, that's absolutely right. So yeah, the kind of the thing that's happening with both the paw pads and the furless is that there's going to be more activity against those layers of skin. So it needs to be a little bit thicker and to be able to protect itself more, because our main function of this is for protection purposes. Good job. Let's see here. So all epidermal layers, that's where we're at. So versus the 3. Pigmented. So why do you think, safety-wise, if we know that this is a protection layer, why do you think paw pads are pigmented? Ashley, what do you think?
Well, I know pigments to like protect from the sun.
Mhm.
So, but those are on the bottom of the feet. So
Yeah.
maybe it helps like so heat doesn't get absorbed as much.
Yep, I think all of that is accurate. And I think that the body just wants it extremely protected because it's so important for safety, for fight or flight, for getting away, for finding food, all of the things that this animal needs to do. They really need to make sure that their paw pads are intact. Good job. Okay, so there are multiple paw pads, carpal pads, metacarpal and metatarsal pads, and digital pads. Let me see. So carpal pad, you see this guy up here on the carpus, so that's pretty easy to remember. Your metacarpal pad is this lovely little heart-shaped pad here, and your digital pads are your toe pads. Okay, so you need to be able to identify those. This is a drawing, but I mean, if you've seen that conical papillae on the bottom of paws. So what about an older animal or one that's maybe really active? What can you tell at the different, maybe especially the metacarpal pad? Sometimes it looks different. What have you seen? Diana, what do you think?
They're cracked and rough.
Yep, cracked and rough, or even smooth, right? Have you ever seen them where they're like the conical papillae are like sticking out on the side kind of, but the center of the pad is real soft?
Mm-mm.
No? So
I'll have
that
to look
can
into that.
happen. Look at your older patients, you know, look at their paw pads. A lot of them from all this walking over time on cement have actually worn away that conical papillae and made it softer. So these are really good things for you guys to look at as new technicians because different stages of life, they do look differently, and it is such an important part of the body. All right, what are we on? Okay, the book says plenum nasal, but I'm not that fancy. So I've only ever had it referred to and heard it as nasal plenum. So I don't care which way that you say it. If you want to be fancy, if you're feeling fancy, if you're not feeling fancy, totally up to you. But I am going to say nasal plenum because that's how I learned. And that's only the way that I've ever had it referred to. What it's talking about is the top of the nose in dogs, cats, pigs, and sheep. It's called muzzle in cows and horses. The like professional term, plenum nasolabial. I feel like a fancy French person when I say some of these fancy words. So it's usually pigmented when we're talking about not a muzzle, because that's not always pigmented in those larger animals, but in dogs and cats, I guess in pigs and sheep. So you notice that the nose is always a little bit darker. So it's considered aglandular. So it doesn't have a lot of the glands that the other skin systems or areas of the skin have, except in sheep, pigs, and cows. They have tubular glands. And we'll probably, I think we talk a little bit more about that, maybe not, but just know that they have tubular glands, and the rest of the species, they are aglandular. So they are not, this is kind of why, give me a thumbs up or a thumbs down if true or false. True or false that a wet nose in a dog is diagnostic of anything? True or false? True would be thumbs up, false would be thumbs down. Okay, I got Kaylin's threw her false vote in. Let's see, Sharon threw a false, Ingrid threw a false. Alex, I can see your curtains, not your hand. I can't, up higher, up higher. So you're voting true. Diana's voting true, but her face says otherwise. Sharon, what was your vote? You voted false, right? Okay. So it is false. Yeah. So actually noses are aglandular. So it is not diagnostic of things when the animals are, or the owners are talking about diagnostic type things like if it's warm, if it's wet, things like that. So that is a myth. Noses have 3 epidermal layers in dogs, a very thin stratum corneum divided by deep surface grooves. So this picture here is kind of showing you a close-up of those deep surface grooves. And the word plaque, so plaque is, we think about it like gross with like teeth, but you don't want plaque on your teeth. But when you're talking about skin, you want different amounts of layers of cells to make a thick protective plaque. So plaque in skin is typically a good thing unless it's part of a disease process. Make sense? So we've talked about nose, we've talked about skin, we've talked about all these things. So next, we're going to talk about chestnuts and ergots, which I literally have never said that word. I know what it is. So I'm glad Stephanie actually happened to be on to clarify that. So these things are specifically talking about our equine friends. So the chestnuts are kind of those rough parts. Sometimes people who don't have horse experience kind of think that it's either a scar or an old wound. They're dark, horny structures. Remember, horny means cornified, so kind of thickened and dried out on the legs of our equine friends. The ergots, they are vestigial, metacarpal, and metatarsal pads. So they're kind of that same texture of a pad, that real thick, rough, dry. Same thing with chestnuts. They're vestigial, carpal, and tarsal pads because horses don't have them like dogs and cats do. And they're on the medial surface of each leg at the carpus and the tarsus. And the ergots, those vestigial pads, they're on the palmar and plantar aspect of the fetlock. Remember, just terminology reminder, palmar, think the palm of your hand, so the front limbs, and plantar, like a plantar wart, they're on your feet. So plantar is the rear legs when we're talking about horses. So here we go. So there's sometimes hair, like this horse actually looks like its fur has been clipped. And sometimes people who have horses, they do some trimming of like their beard hairs and they cut like a bridle path or they trim their feet. My horses are not that fancy. And so they have longer hair. Maybe I'll take a picture of my horse's feet today and post it in our Hangouts. So sometimes you can't even see or feel these ergot parts. I don't know what word I'm looking for right there. But if you can feel inside there and they kind of feel like a hard scab or a piece like that. So a lot of times owners will call horse vets if they are inexperienced and think something's wrong or that there's a parasite or something. Or I have seen people that have shaved it off because they thought it was just like a scab and they were trimming that area. So this is actually a vestigial paw pad, not paw, but you get what I'm saying. Questions about that? So dogs and cats have a fifth paw pad that we kind of just talked about. In horses, there is no visible vestigial remnant of the fifth digit. That's important. Okay, I'm gonna move on to cutaneous pouches. This actually is not something that I knew a lot about, so I've been trying to do a lot of reading about it too, just so I'm on the same page, but we can talk about that. Sheep, specifically that species, have cutaneous pouches, and they're in the infoldings of the skin. They contain fine hair, which is gross, sebaceous, and oil glands, and they are in 3 locations. So what I kind of read about is that they secrete a fatty yellow substance that dries and sticks to the skin. So it comes out, excreted, comes onto the skin area and the hair. It's yellow and it's mostly made of fat. And those locations are listed there. Infraorbital, so in front of, around the eye. Interdigital, so between, I guess they only have like 2 little fingers, in between their little fingers. And inguinal, which is kind of that groin area. So it's kind of hard to tell what area that is, but inguinal is kind of the groin area. So those are the 3 locations. I think that's really all that I have to say about that. So now, hair, glands of the skin. I feel like we've talked about, we're gonna get specific into some of these other structures that are still part of the integument. So if I were you guys, kind of studying purposes, maybe make yourself a list also, because these structures are still related to and part of the integumentary system. So starting with hair. So hair, it is essential for survival. So it kind of lists there why. Why is that? So thermal regulation, so that's warmth and cooling. And camouflage, especially when we're talking about these animal guys, a lot of these animals require, especially prey animals, require on the camouflage of their fur to protect them. Even predator animals, why would they require camouflage?
For hunting.
For hunting, yeah. So we don't want the prey animals to be able to see them, right? Or that kind of defeats the purpose. I mean, in humans, when we're out hunting, we're wearing bright colors, but that's to protect ourselves from each other is the nicest way I could say that, you know, but in the animal world, when they're hunting, they don't want to be seen from far away. So let's see. Go back. Did I go forward? No, we're good. So the core, do you see that on the picture here? Medulla, it's the core. Okay, there we go. So my computer is freaking out. You can still see it? Can you guys still see the picture? Okay, perfect. So there's 3 layers of hair. So now here we are back to layers. So the medulla is the middle layer. It's the core and it's flexible. It's composed of 2 to 3 cell rows separated by spaces of air. So fascinating, right? There's actually air inside that core of the hair. Layer 2, the cortex, that's out here. That's thicker layer. It's stiffer, it's rigid, and it's composed of hardened keratin. Because the interesting thing, guys, about all these different structures and areas of the skin is they all have the same basic cells. Actually, that reminds me so in your book, in chapter 5, which is not a chapter that you were assigned to, there's a tissues section. I recommend that you at least look at, let me go to it real quick. Page 105 is kind of the first page of the chapter, and it's talking about epithelial tissue. So it gives you a good idea. It kind of helps with like the different goblet cells where those are found, because we don't really talk about it. You're kind of just expected to understand that. There's a general characteristics of epithelia. That's important. Kind of how they're attached, the different basement membranes. That's important. But there's one really good image. Where is it? Aha, okay. So pages 108 and 109, jot that down. It classifies epithelia into the specific kind of cells that make it up. So not even talking about the layers of cells. This is kind of a whole different thing. But how all these tissues have the same kind of cells and structures. They're just either squamous, where they're flat, cuboidal, where they're together, columnar, which they're tall. So I think you guys should read at least pages 108 and 109. Kind of, there's some pictures on 110 and there's a picture on 111. So I suggest you read those because that will kind of help make sense of some of this stuff, of the different layers. So hair is the same thing. It's still part of the same system. It's still made up of kind of the same cells. So the cortex itself is composed of cuboidal cells of keratin. So you can kind of see them thicker here. And then number 3, cuticle, you see that down here in the bottom. So the cuticle is the hair surface. So see this thin line around? So that's what it is. That's the hair surface. That's the outside. It's like a roof shingle. You can kind of see it here. It says scale-like squamous cells, and you'll read about the squamous cells and the cuboidal cells and the columnar cells in that tissue chapter. So the roof shingle appearance, why do you think that is? Why do you think?
I think that allows for growth.
Yeah, okay. So it definitely has some parts of growth because they move and kind of grow. This is a system that's always growing and has cycles. There is the main function of it actually is to prevent it from tangling. So it actually keeps it from rubbing against each other. Well, it rubs against each other. There's nerve endings and sensory things there, but it prevents it from just being a giant rat nest. So that's important also. Let me get to the next slide here. Where's my mouse? So growth cycles, anagen, catagen, telogen, and then it returns to anagen. So it's kind of a step 4, but it's kind of a step 1, if that makes sense. So this is active growth phase here. So obviously it would return to active growth phase. That's what that's trying to say. And that can be 2 to 6 years in length. Yet catagen is that transition where it is actually separating the hair from the follicle, 1 to 2 weeks only. So that's a lot faster. And then resting phase, 5 to 6 weeks, the old hair is falling out and the new hair begins to grow. So then that makes sense that it would return to anagen because we're back into that growth phase. Color. So what do you think? What cells? What's the actual word for the cells?
Are you talking about melanocytes?
Yep, so melanocytes, so melanin cells, melanocytes are produced in the base of the hair follicle. That's where those are made. They're transferred to the cortical or cortex and medullary or medulla cells of the hair strand. So each of those layers have cells that are related to those layers. That makes sense. And the different colors depends on the quantity of melanin. So that's what I was kind of talking about with pigment. It's very similar. It's just in regards to hair. There's also, though, with hair, the type of melanin, and that's kind of unique to hair specifically. So there's this pheomelanin and there's this tyrosine melanin. Melanin production decreases with age, which is why we see animals turn what?
The hair turns gray or white.
Yep, gray and white, because that melanin production is decreasing. So those new hairs in this growth cycle, they're not getting as much melanin or types of melanin in them. So their hair color is not as bright. That is exactly right. So melanin produced in the base of the hair follicle. So what produces it, I guess? How is that produced? I guess not the mechanics of how is it produced. Where does it come from, I guess? Have you ever thought about that? What a weird thing to think about. So it's genetically programmed. So that's where colors of different species and breeds and stuff. So think about that. There's all these different color patterns and whatnot. So that's all genetically predisposed and put down through the DNA to get different colors and color patterns. That's amazing, right? Isn't that fascinating? Look at all our different hair color. Don't look at mine though. It's been a hot minute since I've had my hair colored. So also, down to different colors, we talked about the quantity and the type. So here's a good note for you to take, the type of melanin. So the pheomelanin is responsible for yellow and red color in dogs, yellows and reddish colors. And the tyrosine melanin is responsible for brown and black color patterns. So we talked about the melanin production decreasing with age, causing the hair to turn gray, but a little bit different than that is white. So the different levels of gray is from a decrease in production, quantity, and type of melanin, but actual true white hair. What do you think is different with that? Does anybody know? No?
You're talking about like the difference between a dog with naturally white hair and then a difference between a dog that's aged and has less melanin?
No, actual white hair. What is different between white hair and gray hair? Because
There's
even
no
animals,
melanin in the white hair, right?
right?
Like there's
Yep.
none. And okay.
Yep. So true white hair, just like true white pigmentation, is lack of. So it's lack of melanin. But with hair, the cortex loses its pigment and the medulla actually becomes full of air. So there's no melanin. It's actually full of air. So if you get a white dog hair, true white versus gray, a gray hair is going to be different types of melanin still and still those air pockets. But a true white hair is only air. Crazy, right? Do you guys know Tracy, one of the instructors here? She has white hair and white skin. So I asked her if next time we're on campus, if we have microscopes out at all, if I could pull some of her hair out. She said yes. She said I could also probably pick it off the back of her scrubs because apparently her hair falling out cycle has been pretty extreme. So I just thought that was so fascinating. So you can tell between gray and white. All right, we're still on hair. Types of hair. So primary hairs, also called guard hairs, they are straight or arched and they are thicker and longer than secondary hairs. So primary hairs, guard hairs, they stick out further. They're dominant hairs in the complex hair follicle, which we'll kind of talk about in a second. Secondary hairs, these are wool type hairs and they're softer and shorter than primary hairs. So primary hair, secondary hair, and tactile hairs, they're not in the hair follicle like we're talking about with fur, but they are also called sinus hairs or whiskers is what they're more known as, what you probably know them as. So they're used as probes and feelers, and they are also mixed intermittently throughout the hair coat. So you think of the whiskers that you've seen on like kitty faces, maybe some eyebrows, that kind of thing. But yes, there are still tactile hairs throughout the hair coat. Let's see, on my little notes. Well supplied with sensory endings. That kind of puts me on my soapbox about people cutting whiskers. Not a good idea. They have feeling to them, and they are used for balance and different sensory functions. Questions? Are we still on? I think we have one more slide for hair. Let's see. Okay, perfect. So erector pili muscle is a small, smooth muscle attached to each hair follicle. So every single hair follicle, guys, has this little muscle attached to it that can lift and decrease the level of each individual hair. That's amazing. So have you ever seen a frightened Halloween cat puff up, right? So that's a sensory impulse that has caused all those erector pili muscles to raise the hair and make them look bigger as a defense mechanism. It's an innervated sympathetic nervous system response. So that fight or flight, right? So this would be essentially sympathetic nervous system is, yeah, your fight or flight. So you're either going to puff up, make yourself look bigger, and then you're going to decide, like, can I take you, or am I going to need to turn around and run away? So this is your frightened animals. Dogs raising their hackles along the back. So that's their nervous system, their autonomic nervous system is kind of still like, are you friendly? Are you not? I'm scared. I'm interested, that kind of thing. So it's all about the sympathetic nervous system that controls these muscles. So that would be contracting the muscle that makes the hair stand erect. Questions about that? No. Cool. Okay. Moving on to glands of the skin. So we're going to talk about sebaceous glands, sweat glands, or sudoriferous glands, which is really fun to say. Let me see your mouths all say it. Sudoriferous. Sudoriferous. Tail glands and anal glands. They are still skin glands. Okay, sebaceous glands located in the dermal layer, so specifically in the dermis. They are simple or complex alveolar structures, and they produce sebum or lanolin, which is a kind of a type of lanolin like oil. The duct empties into the hair follicle, so the actual gland. You can see it over here on the picture. So the sebaceous gland is kind of next to it, and its duct goes right along the edge and kind of out here where the hair shaft is. Or the duct empties directly onto the skin. So that would be areas like the lips, the vulva, the penis, the prepuce, anus, eyelid, ear canal. So these are all kind of things that those actual areas need to kind of stay moist, right? Sorry if you hate that word, but there's different reasons that the body empties it in different locations. Sebum, very specific to this gland, is oil, lipid, kind of fatty, oily substance, and it's manufactured and stored in the gland. So it's made here and held here until it's needed. The sebum forced through the duct into the hair follicle by the pili muscles. So interesting, when you get goosebumps, when the hairs are moving, that's actually squeezing a little bit of sebum out. So there's those different reasons that you're getting goosebumps or things like that too. Contracts and compresses the gland, boop, squeezes it out either onto the squin. Oh my gosh, I'm seriously having an issue talking today. Or hair shaft. Okay, sebum coats the base of the hair, that surrounding skin, that traps moisture, keeps the skin soft, the hair soft, pliant, waterproof, and reduces the risk of infection. It kind of washes and wipes away different debris and things that are trying to get into that follicle, which is a kind of an entryway into your body, right? So the body is trying to protect it from those things. The sebum actually has antibacterial and antifungal properties. So your body essentially has its own way of washing it. This is why you should not advise people to wash their dogs too much, right? They talk about, if you've ever heard that, you can talk about washing the oils off, but this is why. This is very specifically why. The antifungal and antibacterial properties of the sebum are for a purpose. So we actually don't want to wash them too much. Moving on to sweat glands, AKA, say it. That was your cue. Oh, sudiferous glands. They produce watery, thin, kind of a transparent liquid, AKA sweat, that helps cool the body, through evaporation. So it's bringing some of the heat out and letting it evaporate some of that temperature off of the body. These are found over the entire body, but only horses produce a profuse sweat, okay? So dogs and cats, they don't sweat like horses do or like people do, even though those glands, the sudoriferous glands are all over the body. Here we go again, types. Make sure you write these down. The ecrine or apocrine, however you want to say it. Okay, let me get to my notes. Because now we're going to break it down, two types. Apocrine, those are the ones that empty into the hair follicles. Ecrine, don't care how you say it, they empty directly onto the surface of the skin. Okay, so both types have a coiled excretory portion, see that, in the dermis or the hypodermis. So you can see how this portion is a little bit in the dermis, in the hypodermis. A little bit goes through the dermis to the hypodermis here. In dogs, ecrine glands are only found in deep layers of fat and in the foot pads. So that's why we talk back to that sweaty paws thing. So they actually don't have as many glands, but they do have glands found over their whole body. Okay, you can see them here, goes next to the hair shaft or directly onto the skin. Tail glands. So oval region at the dorsal base of tails of most dogs and cats. Especially large apocrine and sebaceous glands, which then gives it coarse, oily hairs. So that's kind of how you can tell where those glands are in a lot of these, especially intact animals. This also helps assist animals in identification of one another. So this is part of the reason, not just the feces, not just the anal glands, of the reason why they sniff each other's butts. Those are these identification glands here. Especially active, my fun fact to note is especially active during puberty and estrus. So those hormones are kind of in these glands here. And so that's why when they smell each other, those rapidly growing, kind of coming into puberty, becoming an alpha or not the alpha, so that can kind of cause them to fight or smell each other or be submissive, those different things that herd animals do or pack animals. And then in estrus, so they're sniffing and mounting, those things are based off of those tail glands. Okay, anal sacs or anal glands, a reservoir for malodorous, super stinky, secretions, similar to those from musk glands like in a skunk. You guys probably all know that. I know most of you guys all had nursing, right? And got your anal gland skills check off. So we know all about these things. But more specifically, physiology-wise, they are lined with sebaceous and apocrine glands. So remember, those put them onto the skin or into the hair follicle, and the sebum makes it nice and oily and greasy. So normally how it works is that the contents are expressed during a bowel movement or when they're frightened. Raise your hand if you've ever been brutalized by a scared animal's anal glands, because I have, right? Sometimes that's why if you're doing nails and things like that and anal glands, you should probably start with expressing the anal glands first. That way they don't get scared and express them while you're trimming the nails or doing things like that. So that's why. Location in cats and dogs, it's connected by a small duct, which we know that from expressing them, lateral margin of the anus, and these can become impacted or infected. So that's all really I'm going to say about anal glands, because I know you guys learned a lot about them before. Moving on to claws and dew claws. So there's some differences. So claws are the hard outer coverings of the digits. They are non-retractable except in most cats. Except, does anybody, fun fact, like your trivia of the moment, does anybody know the feline that has retractable claws? I mean, non-retractable? It's a cheetah. I like trivia. That's fun. So it's the cheetah. Otherwise, even big cats and domestic cats are the same. Functions of claws: to maintain good traction. They're a tool for defense and to catch prey. That makes sense. Dew claws, however, are evolutionary remnants of digits, and it's the first digit in dogs. second and fifth digits in cows, pigs, and sheep. That's kind of an important note. That's not something that really sticks in your brain. Make sure you write that down. I'll give you a second. So also, in cats, not except, in cats, claws, they are not separate from the distal phalanx, which is why declaws can be controversial, right? Because in a declaw surgery, you're actually amputating the entire P3 because the claw is a part of the actual phalanx. That's kind of why. What is the difference between a cat and a comma? Oh, this is a fun pun. One has claws at the end of its paws, and one has a paws at the end of its claws. Okay, let's see here. Doing good. We got this. So hooves, I think this might be hooves and horns, I think are kind of our last topic. So the hoof, another word for hoof that you need to know is ungula, which is why that some animals that have hooves or hooved animals are called ungulates. See that word here in red? So that's a horny or cornified outer covering of the digits. Okay, it's a lovely, lovely picture here of a hoof in case you don't know what a hoof is. So each hoof covers a digit. So it's a covering, the hoof is itself. That's why it's part of the integument, because it's still made up of different layers and pieces. So hooves, remember hooves are actually an outer covering. They rest on a tissue called corium. Guess what it is? It's the dermis, surprise. So the dermis or the corium has an inner layer or modified dermis and an outer layer, which is a modified epithelial layer. So hooves are a little bit different than your regular skin layers. Corium. So, ouch. Have you guys ever seen a picture? Did Stephanie, if you've taken equine, show pictures of like a deceased horse with the hoof taken off? How it's all like fibrous, very vascular. Yeah, so that's the corium that we're talking about. So both claws and hooves rest on this underlying sensitive tissue. In dogs and cats, what's it called? What's another term for it?
Are you talking about the quick?
Yep, exactly. So the quick, that nervous part that will bleed if you cut it, that's underneath claws. And in horses' hooves, it's called the corium, specifically here, the dermal tissue. So more types, more layers. So here's the 5 types in the equine hoof. So corium being the modified dermis, but now we have 5 types. So they are listed here for you. And this picture actually has the color correlated with the image here. So I would make sure that you know that for labeling purposes and understanding purposes. Okay. So my only kind of main note of things that I wanted to talk about is this level 1, like we're in a video game, lamellar corium. So I had written down, which I thought was pretty important, is a primary and secondary lamina that provides nutrients to the interdermal structure. So this is physically holds the hoof onto the bone. Okay, so think about that. So we're talking about how a hoof is an outer covering. So the hoof has to stay onto the bone because it's covering the digit. So this primary and secondary lamina produces nutrients to the internal structures. So that's why it's so vascular. Kate, I'm going to ask you this horse question. So what is a disease of this area that is common in horses? If this area was to get inflamed, that's your clue.
Laminitis?
Laminitis, yeah. So when a horse has laminitis, it's inflammation of the lamina. So that's what we're talking about. This is actually the area that connects the hoof to the bone. So what happens is it becomes inflamed, it disrupts the like connective areas, so the bone is loose in there kind of. How painful would that be if like your bone was loose on its protecting covering? So it can turn and shift and things like that, that puts pressure that it's not supposed to be onto this lamina and causes the inflammation. Does that make sense? Thumbs up, thumbs down? Any questions? Okay, so that's pretty important because laminitis is a really serious equine issue. The heck, my mouse stopped working. Okay, I didn't really take any notes here, but this is just a really good picture showing bone, that there's a digital cushion, the corium, basement membrane, which you'll read about if you read those pages of chapter 5 that I talked about, and then those different layers of the horse foot tissue, I guess. So more pieces, the frog, the sole, so kind of that outer portion, that cornified layer of the bottom of the foot, the digital cushions here, the different pieces. So this is just kind of a good picture skeletal wise. Ooh, so really good image. Everything is very red, very vascular. So there's that middle phalanx. Remember, we talked about skeletons, like there is stuff inside those bones. They're not hollow. So this is kind of a cool picture to show you that inner cortex versus the harder outside structures. Okay, a couple more things to talk about for the horse foot. So we've got the wall. Let me see if it's above your faces. There we go. Hoof wall. Then number 2. So here's hoof wall here on this picture. So that edge, harder surface here. Number 2 is the sole. So here's the word sole here. So outside of the frog, which is this triangular V shape here. There's the frog, the sole, which is the plantar or palmar surface. No. The junction of the sole and the hoof wall, right here. That's not the plantar surface. I think that's incorrect. Don't write that down. Cross that off. And then white line, though, is the junction of the sole and the hoof wall. So the sole is this inside part here, hoof wall is the outside. So there's that junction there. So that's an important term, which is the white line. And then the frog, which is this triangular horny structure here. The central sulcus is the cleft. Okay, so those are just kind of some important pieces. Here's another good, it's kind of the same stuff that we talked about, but another good image. I like that there's a lot of these different images so you can go through and kind of quiz yourself and make sure that you're understanding all of the pieces. Okay, that's hoof stuff. Okay, last kind of topic we're going to chat about is horns and antlers. So horns is kind of like a hoof. It's a mass of horny keratin, so those cornified keratin cells. They do grow continuously and they're not sex related. So males and females have horns. What's the term? I don't think it's on here. If things are bred out that don't have horns. Y'all better know. What was it? Say it again. Polled, yep. So polled, then they don't have it. Structurally similar to hair. They're epidermal in origin, though. So I think that's all. Hold on. So like a hoof, because it's a covering, I'm trying to think of the important things I want to make sure we grasp. So like a hoof, because it's an outside covering, but it's like hair because of its growth structure. Does that make sense? Is that worded correctly? Kind of saying it's like two different things. They emerge from the horn process of the frontal bones. So as you are identifying your skeletal skull bones tomorrow, you'll be able to identify that area. Kind of a comparison. So horns are not sex specific. Males and females have them equally based on genetics, actually. And antlers are primarily on males. Horns are epidermal in origin, yet antlers are dermal. Horns grow continuously like hair, and antlers are completely shed annually. Horns are hollow and communicate with that frontal sinus bone of the skull. And antlers have they're protuberance from the skull itself. And they lack a central core and internal blood supply versus horns that have a blood supply. And there's that velvet skin on antlers that provides the blood supply. There is a really cool kind of description. Hang on, this is the last thing I want to go over with you. Oh my goodness. All right. it is on page 168. So make sure you really look at that. On 168, there's also a really good clinical application of the laminitis that I was talking about. So make sure you read that. Goes on to the next page and has some really good pictures of different showing that kind of stuff. But it talks about the velvet skin. You know, when you see deer and elk and whatnot, and they're rubbing the velvety skin off. So make sure you read that, because it's talking about that velvety skin is actually a tissue that provides the nutrients in the blood supply, and that it dries up and it, you know, helps it grow and all that stuff. So make sure you understand that part and reread that portion of it. I think that is all that I have. Okay, so any questions? This is your moment for questions. No? You guys got it? Okay. Well, then there's some class activities for you guys in regards to this body system.